I bring my dog, for instance, every day. When we have a patient, sometimes it changes their focus. It gives them something else to look at, brings them joy, takes them away from the place that they're in when there's a behavior or something. Going for a walk outside or even watching me throw the ball and her play has been a wonderful asset to some of our patients here.
That's awesome. What are some other non-pharmacological interventions that we provide for our patients?
Calling family, going to group activities. Sometimes we can do a little one-on-one with them for short periods of time and different staff members. Snacks,
yeah.
hydration, things of that nature.
That's perfect.
So I would say patience, more patience with them, and maybe more distraction to distract them, and I feel like pulling them out of the room and if possible and taking them around with me for just a little bit helps.
A quiet environment with dim lighting, repositioning, distractions, like visiting with another resident or participating in an activity. Those are my main ones I do. One-on-one and redirection.
So a couple of the biggest things that I found have worked is a lot of the time, if it's like a confused patient, for example, they just need redirected, and that usually helps. If you just sit and talk to them and validate their concerns, especially, listen to them and make them feel heard. And then what I like to do is, like, after knowing the resident, I like to talk to them about something that they like to talk about. For example, there's this one lady that I work with on a regular basis who loves her church, and she sees her church people regularly. She sees them once a week. And so I try to kind of steer onto that topic and talk to her about that for a little bit, and that usually gets her in a better state of mind, and she calms down, and it's easier to kind of redirect her and get her into a better place from there. And there are other things like, for example, there's a resident who gets agitated very easily, but this is kind of funny, but she loves her hair brushed, so I'll just take her into her room and brush her hair, and she's happy as a clam right afterwards. So that's just like a funny thing about her that works. And then another thing is for confused patients especially, sometimes they're needing something but they can't express it. And we have one lady who gets very combative, but when she does, it's usually because she's either really tired or she needs to use the restroom. So when she starts to get agitated, we just take her to the bathroom and lay her down into bed, and that usually does the trick.